I'm Dr. Poliano, and today we're going to talk about feline allergies. So feline allergies are similar but a little bit different to canine allergies. So an allergy is the immune system's overreaction to stimulus or things that they're exposed to, causing adverse symptoms. In cats, we see 4 types of allergens: contact allergy, flea allergy, food allergy, and then environmental allergy, sometimes called inhalant or atopy. The different types of allergies may cause varying types of symptoms as well. So you can have itching of the skin in either a localized area or throughout the entire body. You can have respiratory symptoms, so coughing, sneezing, wheezing, sometimes increased eye discharge or nasal discharge. And then finally, you can have digestive system symptoms, so vomiting, diarrhea, excessive gas, generally just upset tummy. Contact allergies are the least common because they have a fur coat covering, but this is something that comes into contact with the skin and causes localized itching. Usually if you take the stimulus away, the allergy goes away. So this could be a collar, a type of bedding that their skin reacts to, or just a chemical that was used to clean those areas. Once you find the source and take it away, they get better. Flea allergies are unfortunately a big deal, especially in Texas. We have lots of fleas. It's just the perfect weather for it. So a normal cat or dog, even, if they get bit by a flea, it's a mild local reaction itching. A flea allergic animal is actually allergic to their saliva, so they can have a full-blown allergic reaction just from 1 or 2 flea bites. They'll scratch and chew and lick and pull hair out, and they'll cause secondary infections on their skin. Sometimes you'll notice little pinpoint scabs all over, especially around the head and neck and ear area. So with those, we need to take the fleas away, treating the environment, treating them with a preventative. And then sometimes we have to treat the secondary symptoms. So sometimes we have to do steroids to take the inflammation out, get the immune system to calm down, and then antibiotics as needed if there's a secondary infection. Inhalant allergies, or atopy, is very similar to ours. It's things that they're exposed to in the environment that they pick up through inhaling pollens or even just contact outside on their skin. They can actually absorb it systemically. So these are same things we're allergic to. So pollens, ragweed, your grasses, your molds, your dust mites, basically things in the environment around us and our furry friends, they're going to react to. Their immune system starts picking up on that and overreacting and causing itching. Generally, it's going to be systemically. So all over their body, they're going to be itching, scratching, again, pulling hair out, chewing. What we have to do to treat that is we can try to systemically suppress that reaction with things like antihistamines, steroids, fatty acids, treating skin irritation with medicated shampoos. So all of these things to help the symptoms, but we can't fix allergies. So the second approach is actually doing allergy testing like you or I would think of in human medicine, where we found out exactly what they're reacting to, and we actually produce a serum that either is injected or given under the tongue to kind of train the immune system not to overreact. So they would get these allergy shots, if you will, and hopefully over time we're going to see the symptoms subside and then be able to return to more of a normal life. Food allergies can cause all of the symptoms we mentioned earlier, so skin, respiratory, or GI tract. As far as treatment, what we have to do is we have to do a food trial test. So we're going to feed them a hypoallergenic special diet, and then we have to observe them only on that diet for 8 to 12 weeks. That can be the hardest part. So No cheating. They can only get that special diet or special treats that go with the diet. So no table scraps, no mousing or catching things outside, no stealing from other housemates' food. And it takes that full time period, the 8 to 12 weeks, for all of the antigens to get out of their system. So we know specifically whether they're responding to the special diet or not. Once we figure that out, we can actually either keep them on that diet long term if it helps and works, or we can sometimes pinpoint exactly what they're reacting to and go to a diet, a regular diet, but doesn't include that specific antigen. Once we can remove that fully from their diet, usually they go back to living a normal, happy life.